So the healthcare issue, the issue of providing health insurance for every American has been the big issue in the United States for month after month after month. In fact, some people are saying, why are we talking about healthcare when the real issue is unemployment? There's been an extraordinary, just today, for you people who follow the markets, just today, with a meltdown in Dubai, there is now a precipitous decline in virtually every single market in the world. The stock market fell over 100 points. This is on a Friday. I can guarantee you we will know a lot on Monday concerning the world markets and the financial meltdown in Dubai, which once again is in the simple way of putting it, some loans have come due and the money isn't available. But let me get to my point here. The healthcare issue is really an economic issue. It's really about what this country can afford in terms of providing healthcare for its citizens. And people keep saying, well, we can't afford this new healthcare program. And that is to the point. It is to the point to say, can we afford what it will cost? We can't afford not to do it. It costs enormous amounts of money to not have health care for every American citizen. This is the key point. It's not that people don't get health care. It is that when they do, the rest of us pay for it, usually with higher premiums for our health insurance. So we have to bring health care to these people. Not only is it a moral imperative that people should not die in this country simply because they don't have health care, or go bankrupt because they don't have health care insurance, but that we can't afford to not give everybody health care. So how are we going to afford this? If we really are concerned about how much money we have in the budget for the health care insurance, for maybe even a public option, that's really the right thing, a public option for health care insurance, where do we get the money? Do we tax people more? Are they going to vote for senators and congressmen and congresswomen who actually raise their taxes? Probably not. This money has to come from our defense budget, but nobody wants to mention it. The defense budget is by far the biggest item in our budget. It is every year. It's $600 billion. Much of that money, a huge amount of that money, goes actually for health care and pensions, but the rest go for Afghanistan and Iraq and everything else that we do that is so costly in terms of going around the world, either nation creating or trying to fight against terrorism, or doing something in terms of creating peace and stability in the Middle East. All these things have their value. We can't afford them. This is the real issue. Can we afford to send 40,000 more soldiers to Afghanistan at $40 billion? $40 billion more? We spend at least $1 billion a week, at least $1 billion a week for Iraq and Afghanistan. Can we continue to afford to do this? Not in a country that's talking about whether it can afford to pay health care insurance. This means a massive change of point of view, a massive change in the framework of our understanding our role in the world. We simply cannot afford to be the policeman for the world. We can't go chasing after terrorists all over the world. We do need to keep ourselves safe at home. We need a strong defense at home. We need to pay a lot of money for the defense at home. We cannot send soldiers around the world. We cannot afford it. It does bring up the Fort Hood incident too, because with all the billions that we spend trying to protect ourselves from a terrorist attack, say, from Afghanistan or Iraq, that there's some relatedness to terrorist attacks in these two countries. Here we have a terrible incident in Fort Hood, which is really, in many respects, a reckless and irresponsible policy towards monitoring the people in our armed forces and the risks involved there. So rather disparate story, but all very relevant and all very significant, you will soon see.